on where we going, where we driving, and she just rubbernecking, looking at everything else. But, you know, I'm glad I'm the one that's driving right now. You know what I'm saying?
Yeah, we'll let him drive and talk. And I'll just sightsee.
I get to talk all my trash while I'm driving.
And listen. All right. So we're going to move on to the treatment plan. What are your common treatment recommendations for plantar fasciitis?
Some of the common treatment recommendations are starting with ice. Excuse me. Starting with ice because that helps to decrease the pain. Give me some water.
You're choking over there, y'all.
I'm choking over here. Talking too much.
Dry mouth.
Yeah, I love ice therapy because decreasing the pain at the heel, of course, is one of the main goals that we have. I like massage therapy as well. There's a lot of times we do have a lot of additional fluid that may build up within the musculature and things like that. And I like shoe gear changes. So how are we walking, and what do you have on your feet makes a big difference. So those are three of my more common early treatments before we get into some more high-level treatments.
All right, so we're gonna keep this one rolling.
Okay.
For your ice treatment or ice therapy, give me some examples of how I can implement that at home.
So generally speaking, I would have people ice in the morning if they have the opportunity, depending on what their schedule is. They're definitely icing at nighttime before they go to bed, for sure. And if they're in a work environment or a school environment, I try to implore them to ice during the daytime as well. So I love 3 times a day for a lot of my patients.
So am I icing the whole foot? Am I just icing the arch of my foot? Am I using an ice pack?
Gotcha. I have my patients ice the actual heel itself because that's where the most common area of pain is, but they can also ice their midfoot. And generally speaking, they're putting an ice pack or an ice bottle or the hot cold massage ball on the floor, and they're just putting their foot directly on top of it. So that's what I'm doing with a lot of my patients.
And I'm leaving it on for how long?
So I like to leave it on for different time frames, anywhere from 10 minutes to 15 minutes to 20 minutes. It all depends on the person. So that's a recommendation that I give to an individual directly.
All right, we're going to cut it. It's raining too hard. You got to pay attention.